This video is going to be about some conclusions that I've been coming to over the past couple of months that I feel like I should have realized years ago. And I'm going to go over some symptoms to know this is the case with you. And my title, or at least my two ideas for a title, are: have you been getting gaslit about, hold up, because I almost lost the paper. Have you been getting gaslit about having diabetes? Or do you secretly have insulin resistance? In another video, I mentioned how digestive issues are also about pancreas issues, not just the stomach. And as a side note, also possibly a liver and gallbladder issue. I've recently came to the conclusion and realization that I still have I still have iatrogenic insulin resistance / diabetes, which actually at some point went from the metabolic syndrome / type 2 category to type 1, hence my low C-peptide levels dropping down to 80 pounds at 14 after being let off the psychotropics that you get forced on in the Cash for Kids system, which I was on mid-12 to early 14, and getting stuck at 80 pounds and having medical professionals tell me I was having too low A1C and blood sugar instead of the high ALC blood pressure, high blood sugar, etc. I used to have while on the drugs. Iatrogenic illness, especially from Cash for Kids system drugs, is as much about brain damage as it is about the organ damage that they cause. Because as you may know, the whole point of these drugs is to turn off the neurotransmitters that make the body work, which there's a lot I could say about that. One thing I can say though pretty quick is that that's why you get the quote-unquote constipation, which isn't actually constipation, but it's the drugs turning off the neurotransmitters that make your bowels work, which is why many people eventually die from that side effect, but then they cover it up and claim that they died from something else, like a stroke or a heart attack from diabetes, which the diabetes and the heart issues also come from the drugs too, but they just lie and lie and lie. Because I actually know someone who died from the turn off the bowel side effect and also had the diabetes / metabolic syndrome, which you get automatically. They just usually don't actually diagnose you with diabetes, so you always get it when you get put on these drugs like Xanax and all these other things, but they usually don't actually tell you that you have diabetes. But anyway, she had that and the heart failure, and she had to turn off the bowel side effects so long that eventually her bowels burst and it came out both ends, which isn't good. But it happens a lot, especially in the actual facilities that they throw people in, but they just don't actually admit that it happens. But anyway, this is also tied to doctors and GA who would admit my Munchausen situation, of course, who would admit the Munchausen situation, but of course do nothing about it because I'm their paycheck at the end of the day. And these doctors and GA would say that they felt like I was just being starved at home pretty much, which there's so much I could say about that. But they felt like I was being starved at home and that my mom was just like pretending that she didn't know why I was sick. And the reason that they thought this was because of all the other labels that my mom would say I had. But it was just a lot of bullcrap because of course they didn't even do anything even though they said that they felt like I was being starved at home. I would honestly love to know what all my test results actually said. And this is something that I mentioned before. When you're asking for tests and blood work, or doctors are saying that they're doing tests, ask to actually see the test. Ask to actually see the test results and actually see what tests they're doing. Because another thing is that they'll lie and say that they did tests they didn't actually do. Although, I honestly really wouldn't advise going to a doctor at all and would advise you treating yourself. Because, they don't treat people anyway at the end of the day. They just give you a diagnosis. Maybe, possibly, because you can't even really get them to do that. But anyway, trying to remember where I was at. Yeah, and as a side note, the symptoms that I was showing at this point in time were actually all pelvic floor dysfunction from mold toxicity because the house had mold, which honestly, most buildings have mold because of how cheaply they're built in the U.S. out of wood and different things like that. They're really just wood. So that was the main reason I was sick then, and that was the main thing causing my symptoms. But the doctors eventually just got so stuck on the fact that I was 16 and 80 pounds. Cause this was a little before I left, so they were so stuck on that they kind of just stopped. Well, they never did care, but to make it short, they stopped caring about everything else and started focusing on why I was 16 and 80 pounds. And then told me to eat more peanut butter and start drinking milk again, which they really did say that bull crap. They even gave me a paper that said something about the calories in peanut butter and other stuff like that, which I stopped drinking milk because I couldn't digest it, or really anything. And I didn't even know that at the time, and that's why I was in so much pain. Or at least that was another reason I was in so much pain, because I couldn't digest food. And also probably had the diabetic gastroparesis. But it's hard to really know that, but I do know that I definitely couldn't digest anything. And it was only some months ago that I really started taking the HCl, the betaine HCl with pepsin, the right way every day, and actually got benefits from that. But now I have to take it less because some kidney stuff that happened from my blood sugar dropping really low when I tried to do carnivore diet for 8 days. And there's a lot of regrets with that, but that's a whole nother video. So yeah, they just said that bullcrap. And the thing is, if I'm being starved at home, then you already know that I can't just eat more peanut butter, drink milk anyway. But anyhow, I've realized the spine issues I started to notice more in August 2023 are blood sugar related. As a side note, I wouldn't advise letting a doctor or anyone talk you into calorie counting. Oh my gosh. It can cause eating disorders. I don't think I can say that. And won't help. Trying to shove down 3,000 calories a day when you can't even digest food will cause more pain and no gain. So you're still not going to gain any weight at the end of the day anyway. You won't be able to gain weight until you get your blood sugar under control and insulin up. Which, at least if you have type 1/low C-peptide, then you need to get your insulin up somehow to actually be able to gain weight or really take in the food the way you should be. Because I still definitely feel like even with the HCl and whatever other digestive supplements you could use, if your insulin isn't really working how it's supposed to, your body still isn't going to place the fat and you're still not going to be able to gain muscle. So, I mean, using the HCl may have you in less pain and, you're not crapping out strawberries and stuff like that. But it still only does but so much. So, some symptoms. Loss of body fat and muscle mass, SIBO, yeast infection, UTI, or yeast infection or UTI symptoms with no positive yeast infection or UTI. Kidney pain, which can also seem like stomach pain. Actually, what I've mentioned before is that once I started working on my digestion, I realized that a lot of the pain that I thought was coming from my stomach really wasn't. Some of it was colon pain, and now some of it's kidney or bladder pain, which is called IC, which I also had IC when I had the mold toxicity, but I had more than IC though. I had spastic colon and other crazy pelvic floor dysfunction symptoms back when I had the mold toxicity. So it was a lot more than IC. It was honestly worse, way worse. But that's because my body, or really anybody's body, is going to try to get out the mold and push the mold out of your urinary system or your colon or whatever. And so that messes with your nerves and stuff, and it pretty much just causes terrible symptoms, to make a long story short. So it causes crazy pelvic floor dysfunction, especially if your liver is already down or is low functioning and your digestive system isn't working, you have low HCl. Anyhow, kidney pain, low HCl / inability to digest food, proteinuria, can't digest fat or protein, blood sugar crashes and spikes, constantly falling asleep, always hungry, more hungry after eating carbs, terribly dry skin to the point where your skin is like bleeding all the time, especially when you get cold. And the reason that happens is because you have poor circulation, which also causes the cold hands and feet. Sugar, bread, cheese, dairy cravings, etc. Dizzy, fatigued, hot, I already said cold hands and feet, blurry vision, can't see, confused, thirsty, constantly having to pee all night, having to ignore the fact that you have to pee just to try to sleep at night, waking up with bladder pain because you have to pee. Another thing that revolves around kidney issues, you get itchy at night all over, or you get really itchy when you have to pee and you don't stop being itchy until you pee. Also, itchy thighs or itchy backs of thighs. Feeling like you have to pass out all the time, which is a part of low blood sugar. Falling, bumping into things because you can't see them because you're just unbalanced because your blood sugar's low. Also could be leftover brain damage from the serotonin syndrome and other side effects. Can't breathe. High blood sugar or low blood sugar causing lack of periods. Migraines, commonly from high blood sugars, but maybe low blood sugar can cause this too. What seems like anxiety, mood swings, or DPDR, which is depersonalization and derealization, which is all from low blood sugar, but of course in the modern day medical system, where they have this mental illness obsession, at least in the West, they love to throw mental labels around. Low white blood cell count, neutrophils and leukocytes, I think that's what they're called. I have that, and I've had it for over 5 years now, since the drugs, which revolves around type 1 diabetes. Red blood cell count, although I haven't had low red blood cells since I left my previous situation, so last time I checked, my red blood cell counts were finally normal. Same with my iron, which had always been low throughout my whole life, which I believe is because of diet. Because like I said, since leaving my previous situation, I don't have low iron anymore. At least the last time I checked, I don't anymore. Low blood sugar keeps the body from functioning how it's supposed to. So pretty much your body can start shutting down over time. But they use that line to try to push you on insulin if they'll even actually admit that you have what you have. But I wouldn't advise getting on insulin because then your body gets dependent on it. And then you're guaranteed death, most likely. And plus it's really expensive, so people end up rationing insulin, which also makes them just die really quickly. You get on insulin and then you die pretty much. And I mean, the reason I have the issues I have is because of their quote-unquote meds anyway, so yeah. Diabetes can cause SIBO and yeast infections due to high sugar levels in the body and low stomach acid. Whether you're obese or skinny, both of them pretty much can come from the same thing. So insulin resistance, although when you become underweight, it's because you've had it for so long that your pancreas has just really started to burn out and may eventually stop producing insulin altogether. Also, the standard American diet, we're overfed but malnourished, and microbiome imbalances. And unfortunately, due to the crazy weird beauty standards that are pushed today, that'll have you walking around looking like a dude, people have been made to believe that having no muscle mass and no body fat and being cold in 87 degrees is a good thing. but there's a lot I could say about that. Confusion, brain fog can come from diabetes and mold toxicity. I used to think that like a lot of my symptoms were just about the leftover brain damage or the leftover issues from mold toxicity, but I've now realized that some of it is just because of the insulin resistance, and so that's why I can't really think straight sometimes. But yeah, another thing that they cover up, they tell you that the drugs just make you eat more just because, but the reason that the drugs make you eat more is because they're giving you insulin resistance. Uncontrolled blood sugars actually damage the vagus nerve and cause low stomach acid and gastroparesis. And that's pretty much it.